Good afternoon, and welcome to our weekly COVID-19 public health update with Montgomery County Executive Mark Elrich. I'm Lorna Virgili, Public Information Officer, and joining us today is Dr. James Bridgers, who is our Acting Health Officer, as well as Sean O'Donnell, who is Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Dr. Earl Starter, who is our Assistant Chief Administrative Officer. And also today we have two additional guests. We have Kathy Durbin, who is the Director for Alcohol Beverage and Services. And also we have Kelly Grove from Visit Montgomery. We do have a hard stop at 1:30, but that is only for County Cable Montgomery Broadcasting. Those of you watching through that outlet, note that Facebook Live will continue, as well as the YouTube channel, the county's YouTube channel. With that, Mr. County Executive, good afternoon to you, and let's get started.
So first of all, thank you all for joining us this week for our media briefing. I'll start on COVID. This week, our COVID case rates and positivity continue to increase. As you can see from the chart, our case rates are higher than they were this time last year. And 97% of all of the cases in our region are the BA2 subvariant, and I think subvariants of the subvariant. So there are a couple of other actors out there now. But the good news remains that our hospitalization rates remain low. And currently Montgomery County is at a moderate level of transmission of COVID, but remains in the low community level according to the CDC. The current surge we're experiencing is the first one since the pandemic began that's not creating an increased strain on our hospital system. And this is the evidence that vaccines and treatments are effective protection from severe illness and hospitalization. As reported today, Dr. Fauci said, we're really in a transitional phase from a deceleration of the numbers into hopefully a more controlled phase and endemicity. In other words, becoming endemic. I hope he's right, and I hope we don't get variants that in the future are more evasive of the vaccines. But for the moment, we're definitely seeing the benefit of the vaccines that you all have been taking, and it's keeping people out of the hospitals, which is the most important thing we can do. Remember that though the vaccines do wane over time, they are continuing to confer some level of protection. So they may not keep you from getting sick, but they can keep you from getting very sick. And so it's very important to get boosted and to remind our loved ones and our friends and our coworkers to get their booster shots as well. As we can see from the gray and green areas on the graph, the peak of our vaccinations was about a year ago. With proms, graduations, end of school celebrations, Mother's Days taking place in the weeks to come, it's imperative that getting vaccinated and boosted remains a priority. It's a perfect time to get it. If you travel or around large numbers of people, please test yourself or get tested. I continue to talk to people who have recently gotten COVID or know people who've recently gotten COVID. So it's not like it's gone away. They're just not taking people to the hospital. Better not to get it at all, and better to get a mild case if you're going to get it. Wearing a mask is still good protection from the virus, and we continue to encourage everyone to wear a mask when riding on public transportation, or if you're in crowded indoor spaces, or especially when you're around anyone who's at higher risk. It's another way to protect yourself and others. Slowly but surely, our lives are starting to return to some sense of normalcy, and the light at the end of the tunnel is getting brighter and brighter. But this is not a time to let our guard down and get too comfortable. I think we all remember those giddy days of about a year ago when we all thought this was about to be over, only to be surprised that it was far from over. So we'll continue to keep people alert to what's happening. We hope everybody continues to take precautions and keep themselves safe, because we're not alarmed by hospitalization doesn't mean that we're out of the woods yet because of the number of cases we're still seeing. I'm glad that the Visit Montgomery President and CEO Kelly Grove, as well as our Alcohol Beverage Services Director Kathy Durbin, are here today to provide you updates on the restaurant and hospitality and tourism industries. Our restaurant and tourism industries play a key role in providing entertainment and a retreat for our residents and visitors. This week is Visit Montgomery Moco Eats Week, and there are incredible deals, discounts at nearly 80 participating restaurants throughout the county. Over the last 2 years, there are a few industries that were impacted as hard as our restaurants. Restaurants have been innovative and resilient during the pandemic, but those efforts still do not account for the losses so many had to overcome. And Moco Eats Weeks is a great opportunity to demonstrate your support and appreciation for our restaurants and employees who work in this restaurant industry. If you've been out to a restaurant, you've probably noticed that in many cases, the hours are shorter than they were before. The restaurant staff is lighter than it was before, and getting a table is easier than it was before. And while getting a table being easier might be a good thing, it also reflects, the continued reluctance of, people to dine in at this point. And that's certainly affecting hours and employment in the restaurant industry. So even though things are better, they're still being affected. We've allocated nearly $12 million in business relief to support our restaurants to assist them and keep their doors open. We really appreciate their flexibility and adaptation, whether it's been through contactless carryouts to expansion of delivery services or the utilization of outdoor dining in our Street Eateries program. Most important, our restaurant owners and managers' adherence to our guidelines and recommendations helped us become one of the safest communities from COVID. I really do appreciate the restaurant industry, as painful as it was, to working with the county and following our guidance through all of this, because to the extent we were able to stay open, the willingness to follow the guidance was critical to even being able to do that. Many of our restaurants have donated food throughout the county and assisted our efforts to help our most impacted residents, and we're really grateful for their partnership and compassion. I also want to acknowledge the work of our alcoholic beverage services over the last 2 years. The pandemic has been a logistical, organizational, and staffing challenge for ABS. However, ABS has been innovative, efficient, and effective, and quickly adapted their operations throughout while consistently improving customer service. ABS generates over $30 million of revenue that the county uses to help pay off bonds that were issued for a major road project. When we're finished paying off the bonds for the road project, we could turn that same profit and use it to provide a steady stream to fund school construction or transportation projects. $30 million a year or more would be a significant contribution to some of the places like schools and transportation where we still find ourselves not being able to fully fund what we know are the needs we have in the county. So this could be really important as we go forward. And at the very least, it replaces almost 2 cents on the tax rate. So even if we don't build something with it new, right now, if we were funding this road project out of county taxes, everybody'd be paying 2 cents more. So you should not underestimate the value. It is a good thing that we're doing this. I wouldn't have supported it if we weren't making money on it, but actually it is a successful project, and it's good to have a business in the county that is producing revenue for the county. I want to talk a little bit about the Crossfines groundbreaking. It's more good news for our tourism and hospitality industry, and tomorrow we will have a groundbreaking ceremony for Crossfines, which is a new development project in Poolesville that'll combine a winery, an event center, and a wine education center. Crossfines is expected to bring approximately $22 million in economic activity to Montgomery County. I am especially excited about this, and I want to tell you why. I brought the idea of a crush pad to Montgomery County more than a decade ago, when through a series of conversations, I realized that Montgomery County had the potential to create a wine industry that would be comparable to what we've seen develop in Northern Virginia. We have the soils, we have the climate, and we have the farmland to create something significant and special here. And our wineries are already demonstrating the ability to produce high quality wine in the county. Crossfines is going to be a critical component for catalyzing that industry. When I started exploring this in the beginning, I learned that equipping a winery is an expensive proposition and a barrier to entry, particularly since it can take 3 years to harvest the full crop. The equipment that goes into a winery can easily exceed $1 million. And so when a farmer has to contemplate going into whether they want to make themselves into a winery, they have to buy the grapes, plant them. They have to wait 3 years for a crop before it's ready, where they can really harvest the full crop. And then if they're going to produce the wine, they would then have to come up with this, $1 million or more in investment in order to create that kind of facility. I learned that crush pads like this exist elsewhere, and they've enabled farmers to enter wine growing and use the crush pads to perform the magic of destemming, crushing, and making wine, especially red wine, and providing the barrels in stainless steel to store the wine as it ages. And this is what a crush pad is. It provides the equipment that a farmer can bring their grapes in, they can crush them there, destem them there. They can hire their own winemaker, or we're going to have a winemaker available at the facility, and they'll help the farmer make the wine there. We'll have the barrels and the tanks to store it in. And this hopefully will generate more folks getting into the wine business in Montgomery County. The value of wine when it leaves the farm is the second highest value of any crop if it leaves in a bottle. If grapes leave the farm, they offer a high return. They're one of the highest value crops, also not as high as grapes in a bottle, but they are very high value. And another advantage is in the state of Maryland, before a winery can buy grapes from outside the state of Maryland, they have to buy the grapes that are produced in the state of Maryland. So farmers who go into grape production find a ready market for their product. And that's one of the important things that farmers need to know when they go into anything is, where am I going to be able to sell it? And the good news is, if you're growing grapes in Montgomery County, you have pretty much a guaranteed market in the state of Maryland. So this is a big deal. Often when farmers reach substantial enough volume, they'll transition to processing wine on their own property. And I'm hoping that Crossvines becomes a cradle or an incubator for creating a wine industry in Montgomery County and the associated tourism that's emerged in other places around the country, including just across the river. So this to me is something that's going to be really important. It's going to be a critical component in catalyzing the industry. And I want to thank Ike, former county executive, for recognizing the potential of this and beginning the funding process that brought us all here. I have to say, in the beginning, I'm not sure everybody was convinced we could create wine in Montgomery County, but the fact is we can create wine, and our wineries that we have in the county already are showing their ability to produce high quality wine. The facility is going to share land with the Poolsville Golf Course and be built on an empty spot not currently used for golfing. In addition to the vineyard, we're planning to construct the 16,000 square foot clubhouse with a banquet and dining hall, a grape crushing facility, a malting and distilling facility, an educational pavilion, picnic area, and outdoor class space. The winery is in collaboration with Montgomery County Revenue Authority, the universities of Shady Grove, the University of Maryland Extension. Students will be able to study grape cultivation, vineyard management, and winemaking at the new facility. Additionally, there'll be a partnership with the universities of Shady Grove to provide hands-on experiences for students in their agritourism, marketing, culinary arts, and other related programs. The project is one of a kind in our region. There's a similar crush pad on the Eastern Shore, and I'm actually Southern Maryland, not the Eastern Shore, and I'm excited to see it open later this year. I hope you'll join us for the groundbreaking tomorrow in Poolsville at noon. But I am really excited about this. It's kind of fun to see something come to fruition like this, particularly when it's something we know is going to have a positive impact on the county, both in terms of tourism. It's going to be good for farmers, and it's going to be good for revenues overall. I want to thank, on another note, I want to thank MCPS Superintendent Dr. McKnight and MCPD Chief Jones, along with their teams, for their presentation to the council yesterday on the updated MOU for our Community Engagement Officer Program. The superintendent, chief, and members of the county council all recognize the balance that has to be achieved between safety of the students, their mental health and welfare, as well as the racial disparities in arrests, suspensions, and expulsions in our school. I was pleased to hear that MCPS is making progress on the hiring of social workers and psychologists that help with the emotional support of our students and de-escalate and prevent incidents from happening. And Chief Jones was clear that the MCPD officers will not be patrolling the hallways, intervening in school discipline issues, and specifically not arresting students for marijuana possession in MCPS anymore. This alone has leveled the discipline rates that involve police between white and non-white students. Just taking, not arresting people for marijuana possession had that much of a difference, and that's important. The school to prison pipeline becomes a sentence for people that could last a lifetime in terms of impairing them from being able to get jobs and opportunities. We shouldn't have a policy like that, and I'm glad to see the change. As a signatory to the modification of the MAU, believe that we're moving forward in the right direction under this model. And I'm now going to turn it over to Sean O'Donnell, Earl Stoddard for the COVID updates, and then we'll hear from Kelly and Kathy before taking your questions.
Thank you, Mr. County Executive. I'd ask that I could be offered the ability to share my screen, please. There we go. Thank you. So again, this week, I think we should be able to move through this fairly quickly. Just to, again, reemphasize, we are continuing to see our case rates increase across the county. And at the same time, we're looking here at the CDC community level markers. We are still seeing, while we have some increases in hospitalizations, they're at a far slower rate than we've had with similar increases in case rates. So the ratio of cases to hospitalizations is very much decreased during the current COVID wave that we're experiencing. We are, of course, also tracking our test positivity with our with the PCR tests that are done at any of the labs across the state. Within our county, our test positivity is just under 5%, and that has now leveled off a little bit over the last few days. We hope it maintains that or starts to go down. It's encouraging, though, that has not continued to increase the last few days. Again, our hospital rates, as you can see, far lower than what we've had in our previous COVID waves. The hospitalizations that you can see there on the right are fairly close in ratio to the overall COVID case rates. You can see now, though, that ours is much lower than it has been with previous ones. Again, we are tracking to look at the impact by race and ethnicity over the last 2 months, with the last month being the rise in COVID activity. We've not seen the disparities in the case rates amongst our Hispanic and our African-American populations during this wave that we saw as recently as the first Omicron spike. What is notable is it does appear to be transmitting a little bit more in some of our other communities right now. And when you look at the Montgomery County's surveillance page, we're just highlighting these. These are community, these are zip codes within our community where we're seeing higher case rates than some of the other zip codes. Again, these are, like much of our county, these are highly vaccinated zip codes. And again, this may be why we're not seeing that serious illness, but we are seeing it spread a little bit more on our in our Bethesda areas, our Potomac areas, compared to other parts of the county. We're just raising this again so that we can emphasize caution amongst the residents of these areas, letting them know there is transmission going on, and encouraging mask use again when you're in indoor settings with other individuals. Again, just to give you a little more detail on the hospitalizations, it's been a very limited increase, mostly linked to acute care beds. No increase since last Monday of our ICU beds. This is data again from this past Monday. So we have not seen an increase in the most serious of illnesses related to this. It is possible, as we saw with the previous Omicron spike, that there some of these individuals who are diagnosed with COVID when they're in the hospital settings, again, they may be there for another reason and have incidentally also have COVID at the same time. So we know that the previous Omicron and this BA2 wave are certainly affecting a much wider range of individuals. Again, we are still tracking deaths and have seen much lower deaths in April than we did in March. To date, we're again hoping that these remain as low as possible. Just to share with you a few data points from our both our national CDC surveillance. Here is the with their forecast for the BA2 and related BA2 sublineages. As the county executive mentioned, we're at approximately 97%. Virtually all of these are of the BA2 variety. The remaining ones are related to the B1 variants that were the previous spread. Looking internationally, what we're seeing is very significant declines in COVID cases across most of the world. As you can see, North America is experiencing those BA2 increases in transmission. I believe the US was close to about a 26% increase from the previous week. We're seeing reported increases in Canada and in Mexico as well. I can't speak specifically to how frequently the data is incorporated from different nations to the WHO. So we tend to focus less on the the absolute amount of percentage change, but more just where are they trending. And as we've seen in Montgomery County and other parts of the U.S., this very much seems to be driven by the BA2 spread. Of note, and looking again at the UK and France as groups that have had similar COVID activity as we have in the past, it's good to see that both of their BA2 waves ended up far shorter than the initial Omicron B1 waves, and they've resolved in a fairly quicker manner than some of the other waves of COVID. What we're seeing both at our county clinics and what we're seeing from the countywide data through the state for both public and private providers is that most of the vaccinations that are occurring now are second dose boosters. We've already seen a little bit of a decline in the week-to-week demand of those, but we're still highly encouraging people to come out and get their second dose booster if they're eligible for it. If they haven't gotten their first, again, as our county executive shared, it's been for many people over a year since they've gotten that COVID vaccination. Very important to maintain your protection level. And finally, the last piece is, again, we've emphasized this for a few weeks, the test to treat sites that are available. I understand from press releases from the White House that there's a significant investment and goal to increase the number of test to treat locations, increase the availability of antivirals. It's a very significant step forward in the response to COVID to not only have testing, not only have vaccination, but have treatments that can reduce the likelihood of hospitalizations in a lot of populations. I believe that some of the literature reviews have said Paxlovid can help reduce hospitalizations by up to 80% in individuals who begin taking it in a timely manner. Again, our concerns are there may be lots of folks out there in the community who aren't aware that that they are high risk, or that there is a treatment that can again improve their outcomes. And we know that over the last few years, a lot of things have gone remote. It may be a lot of people have not been in to see their doctors the way they did in previous times. We are recommending, if you have a COVID infection, please let your physician know, your healthcare provider know. And if you get a positive test and you're in you consider yourself to be at risk, that's probably a good time to go to one of these tests to treat. They have pharmacists on site who can both provide you the prescription and fill the prescription right there. So we do want to get the word out that this is an option to help keep people out of hospitals, help keep people from having serious illness related to COVID. That's all the updates we have at this time. And happy to turn it over to some of our colleagues if they have additional comments.
Thank you, Sean. Dr. Stoddard?
Nothing for me in the intro.
Nothing for me either.
Okay, so we're going to be transitioning to the Q&A portion of this presentation. And I believe Steve Bonnell from Bethesda Beat has got the first set of questions. Good afternoon, Steve.
Good afternoon. Going to the health officer search, I know there was an update yesterday, but I just want to make sure I understand where we are in the process. Has the Maryland Secretary of Health and then interviewed the candidate at this point? And I guess they just haven't approved. I guess I'll just start there to make sure I understand where we are, and anyone can feel that, I guess.
Sure, Steve. I'll provide the additional follow-up. So the selected candidate was interviewed by not only Secretary Schrader, but Deputy Secretary of Health Chan. The recommendations as follow-up to that conversation were sent to Dr. Kroll, who will in turn advise the county executive of the results from those conversations, and then move forward from there with the county executives' feedback, input, and movement toward the county to be vetted for this particular candidate or selected candidate. So that's where we are. So the answer to your question is yes, comments, recommendations will be shared with the county executive, and they in concert will move the selection process forward to the council for the next phase.
To be, I guess to cut to the chase, has he been green lighted by the Secretary of Health, or is that still under deliberation?
Yes,
okay.
He's been green lighted.
Okay, and so the council has a role to play here too in confirming him. I guess I know this is semantics, but Secretary of Health has green lighted him, and now it's going to go to all of you to kind of oversee recommendations, and then it goes to the council for final confirmation. Or am I inaccurate in any of that?
So the council's confirmation is the next step. The county executive was the first step. The Secretary of Health and his designee, which was Deputy Secretary Chan, was the second step, and the third step is now to present the candidate to council.
And I know you're not going to tell us who it is, but can you at least say what the salary range was that you offered, if it was similar to what Gales was making? Or
I'm not involved in that process, so I can't share what the salary range, and that I was participating in the interview and follow-up process.
Does anyone on this call know that? Or
We can get that for you, Stu. I don't know the exact number. I don't want to quote a number off the top of my head, but I don't we have the exact number. I don't have it at the top of mind. We can find it for you though.
Okay. And the only other question I have here is, obviously everyone thinks about COVID with the health officer position. And I think I've asked this before, so apologies, but moving forward, whoever fills this position, you know, obviously Dr. Bridges has been filling in on an interim basis since Dr. Gales left, but can any of you just go into the non-COVID roles that the health officer kind of fulfills when it comes to the healthcare kind of picture in the county?
Sure. Thank you, Steve. I'll take that question as well. So the county health officer is responsible for the overall health, wellness, and safety of the county. So it could be from challenges that we may have with pedestrian safety challenges to immunization challenges to the access of drug treatment therapies and modalities, community health needs assessment, looking at equity and access, to work with our community providers, our hospital system, systems to look at the best practices, to work with our Montgomery County public school system, our independent school systems. And I understand that Montgomery County has a health officer that they recently hired, but to work synergistically to look at those adolescent and childhood related challenges that may develop or arise. So the health officer provides overall clinical and operational guidance to the county executive to look at those challenges that may be internationally or nationally affecting the health and wellness of the county. So all of those duties are encompassing of the health officer. It's been primarily focused on COVID, but in my role as the interim health officer, it hasn't been COVID centric. I've looked at maternal and child health issues, worked with our dental program, worked with our health equity partners, our communicable disease and epidemiology team, our licensure and regulatory team, which we look at pools and food service establishments and regulatory issues with our assisted living facilities and our congregate spaces, and then working with Mr. O'Donnell through his public health and emergency preparedness. So all of those are some of the duties that encompass the roles and responsibility of a health officer.
I just want to hone in on the last part of your very detailed response. Is there anything you want to highlight in terms of whoever's picked here, given that this person is green lighted all the way? Any specific initiatives that are going to be important outside COVID in the coming months as the officer gets started?
So Steve, I started the conversation with our hospital system and some of our clinics. And, you know, my interest is in putting together everybody in this county who has responsibility for bits and pieces of the healthcare system to think about a more seamless and integrated service provision. Because I know that, you know, one thing that the hospitals were hit with were people who had pre-existing conditions that really complicated the treatment for COVID. And we know that, you know, racial disparities play a large role in that. We've got a robust clinic system. The county's for a long time been, you know, playing a role in filling the gap for people who don't have insurance. We rely a lot on, you know, nonprofit partners, as we did during COVID. And I felt pretty strongly, and I think other people agree, that we need to come together and talk about, you know, where healthcare goes in this county, given whatever the federal limits are today. What can we do to more comprehensively address the health and well-being of our residents? And so I hope we're going to begin this conversation and think about how all the pieces might better fit together synergistically, and what are the gaps that we need to think about filling. And the other thing is dealing with mental health. You know, we've put so much focus on, you know, the two workers we want to put in each school. But the fact is, obviously, this mental health crisis is affecting far more than students. And it's affecting, you know, a lot of young adults. When we look at, you know, some of the increase in violence and other things, this is coming, you know, largely from younger adults. And this county used to have a clinic, used to have a mental health clinic system. It got dismantled probably 2 decades ago. And the insurance and the private sector in general hasn't filled that hole.
Do you remember why that was? Sorry, that you've mentioned that a couple of times. Do you recall why that those healthcare centers were kind of phased out?
They didn't want to spend the money, and I think they believed that people's insurance would cover it. which had this huge presumption that everybody had insurance, or that the insurance would actually cover it or cover it adequately. And it didn't. This is probably one of the most glaring failures in the system as a whole, has been the unwillingness to address mental health. And it's true at the state level too. We don't have the beds we need. The fact that our jail is the largest mental health facility in the county, with a third of its residents, presenting with mental health issues, and we don't have a proper place to put them for treatment. And we're not alone. It's not like Montgomery County is unique. Other places have the problem as bad as us or worse. So as a society, we've kind of walked away from mental health. I think COVID is kind of forcing people to actually deal with it. And I'm optimistic that, we can begin providing the services. I mean, this is one of the good things about Montgomery County. People may question me on it or not, but when there's a problem, this county's often been willing to stand up and try to address a problem. We know there's a major mental health problem. We can either wait for the federal government or the state government to wake up and do something, or we can look at the toll it's taken in our community and try to do some of these things ourselves. And, I'm going to encourage people that we look at what we can do within our capacity to provide additional services to people, to help people navigate the kind of mental health issues that they're facing. So that's why I'm prioritizing it. And it's, part of my concern over time has been that, we always look to the state to step in or the feds to step in. They don't.
Thank you, everyone. And I apologize to the reporters on this call who I've been hogging the time from.
I want to give one more thing. I want to first off and say, I want to recognize what Dr. Bridgers has done as acting health officer, has done an exceptionally good job in leading the department. And I want to thank him for his efforts. And as I think he would say, the health officer has a lot of very important jobs. Steve, I know you were with the council yesterday where they had a robust conversation about wellness centers and expansion of school health services. I know we've talked a lot about the opioid crisis. The health officer plays a key role in responding to that. Sexually transmitted diseases and other communicable diseases other than COVID, we talk a lot about. The licensure and regulatory services fall underneath the health officer. So our oversight of the nursing homes and assisted living facilities in the county. And then finally, maternal and child health care. I know we talk about the huge disparities in access and utilization of prenatal care, particularly in our Black and African American community, is a issue that has plagued Montgomery County and many other jurisdictions across the country for decades. And it's one of those things that just warrants a lot of time to address. And so public health is near and dear to my heart. So obviously the public health officer just has such a tremendous opportunity to make long-term gains in the morbidity, mortality, and life expectancy of Montgomery County residents. I think just such an important position.
Thank you, everyone.
Thank you, Steve. Kevin, I see you turn on your camera. You're ready to go, but I'm going to have to apologize to you for a second because I made a mistake. I forgot to introduce the two ladies that are joining us today. They were supposed to give statements and I overwrote that. So my apologies to you ladies. And is it you, Kathy, or Mrs. Gruff, who is going to have some remarks? Or both?
I think Kelly's first.
Okay, Kelly.
Good afternoon, everybody. Kelly Groff is at Montgomery. Thank you, County Executive Elrich, for the plug for Moco Eats. Just a little background. Moco Eats was launched in March of 2020 when our restaurant shut down. And we quickly pulled together this directory that would help residents be connected to restaurants. We had 787 restaurants sign on to this initiative, which really helped keep everybody moving and in business. So we're excited because Moco Eats came as a result. Moco Eats Week came as a result of that. So mocoeats.com. The diversity of our community, we're all so very proud of. And we get to share this through our culturally diverse culinary experiences, which are offered in a lot of different places throughout the county. So we're excited about this week. We're seeing positive signs. Kathy will talk a little more about that. But just in the last couple of weeks, many of you know, Paris in Town opened in Bethesda. Hello Betty opening at Pike and Rose, and True Food Kitchen opening at Rio. So these are all really good signs. And just to add on to the county executive's comments about Cross Vines, we're super excited about the opening and the groundbreaking tomorrow. I just want to remind everybody, we do have a self-guided tour called the Tastemakers Trail. So we hope you'll take a look at that. It's tastemakerstrail.com. Again, that was launched during pandemic and really highlights all the breweries and wineries in the county, and Cross Vines will be added to that. So I'll turn it over to Kathy for some additional comments.
Great. Thank you, everyone. Thanks, Kelly. My name is Kathy Durbin. I'm the Director of Alcohol Beverage Services in the county. ABS is always happy to partner with Visit Montgomery. Montgomery County is such a wonderful place to live, work, and play, and the future looks bright as we all begin to spend more time out in the community. During the state of emergency, restaurants had to create ways to stay afloat. The county liquor board quickly developed flexible online permitting, allowing restaurants to sell alcohol to go or curbside with carryout meals. Licensure fees were waived during that time through legislation. Fortunately, the dip in the number of businesses with liquor licenses in the county was small last year, and the numbers remained steady, and liquor board agendas continue to be full with new applicants. Additionally, community events and festivals that have not occurred in the past 2 years are again being planned for the summer, and local license applications are being received once again. That's great news. To assist the hospitality industry, ABS offers free alcohol server training. It's called Alert, and it's held twice monthly using virtual platforms. Anyone can register on the Montgomery County MD.gov/ABS site or call ABS Communication Center at 240-777-1900 to register. Community outreach staff also schedules business trainings in different languages, educating sellers and servers about alcohol state laws and alcohol policies. So spring is finally here. And this year, ABS was able to work on legislation to align better with the county marketplace license that already existed. So we're very excited about that. And we're excited to bring all of the influences that we have through our retail stores to help the Maryland Made products and Maryland Made program that we work with Visit Montgomery and Moco Eats. So we're happy to do that and happy to move forward. Thanks, Kelly.
Thank you, Kelly. Thank you, Kathy. Now to you, Mr. Lewis, Kevin Lewis, ABC 7. Believe you have some questions.
Thank you so much. County Executive Elrich, are you aware of how many officers, roughly speaking, are currently eligible for retirement with the pension plan that's in place?
I don't know the exact number, but I know it's a lot. And they're eligible. Whether or not they'll all retire is a different question. That's
Right.
partly why we're dealing with, the pay scales in the police department, which the council actually passed yesterday or the day before.
I want to circle back to the pay scale in a second. I reached out to the police department today with a list of questions. I had heard the number was roughly around like 800 of the a little more than 1,200 officers are eligible for retirement. Do you understand that it's that high? And from just roughly speaking, what is the pension? Is it after 25 years of service you become eligible for some amount of pension?
I think it's 25 for police. Is that right, Earl?
I believe that's correct. I can confirm, but I'm pretty confident that's correct.
And I saw you shake your head when I said 800. Is that
I've
off?
never heard that number.
I don't know that it may be some level of retirement that they're eligible for, meaning they can't max out yet, but they could be, there may be some eligibility there. I actually believe the number is probably around 60%. So I think that, what you've cited is 2/3. So that's, I think it's probably a pretty close number. Yeah.
And as I understand it, anecdotally speaking, the pension scale rises from like year 25 and maxes out around like 33 or 35 years. Is that accurate?
It does max over time. I don't know the exact breakdown.
Yeah.
Over of when each tier goes up, but it's all knowable information. I just don't have it off the top of my head.
Okay, so county executive, what are you doing in concert with the council, the police chief, to try and keep those officers in the hundreds from saying, hey, I'm going to pension out here and move on to a second chapter, whether that's becoming a law enforcement officer in Florida or becoming a security guard for the federal government or doing something totally different? What can the county do to incentivize these officers to stay here?
Well, we've actually worked with the union, and this is something that they're concerned with. We negotiated contracts this year, and we negotiated contracts that we thought, and I think the union felt, would address the pay issues and take us from the bottom of the rankings up to, a decent place toward the top of the rankings. And that's probably the most important thing we can do, because if we pay people decently, and we do have a good pension system, if people have better opportunities here, they're going to stay here. But if you can retire and go someplace else and make more money, that path may well be open to you. So we wanted to make sure we finally got ourselves up to the point we needed to be. And this is the second time I tried doing this. We recognized this problem 2 years ago when we negotiated a contract that addressed the lack of adequate pay, and that contract didn't get approved. This contract's gotten approved.
The other thing I would say, Kevin, is one thing I know that the county executive has actually begun to talk about with the union is changing the drop program a bit, perhaps. That's an idea that we brought forward to them, where you can actually extend the drop period from a 3-year program to a 5-year program, which will allow officers to stay on longer before they were forced to leave when they entered the drop program. That's another mechanism. But I will also say that having spoken with the police department, I'm sure you've heard the same thing. Many of the officers that are leaving the department now are actually less tenured. And so that's actually a shift we've seen over time, is that, I think it used to be, the average person leaving the department was, in year 8. And I think it's now down to year 5. And so you're seeing younger and younger officers decide that either this police department or police departments generally, the profession itself is not something that they're interested in pursuing. And so the challenges aren't just with retirement. It's just the challenges that we're actually seeing. The surge in officers leaving the department now is much more based, it's much more younger officers than it is actually our senior officers more retiring early at that point.
Earl, do you mind just explaining the drop program and the incentive that provides officers with?
Yeah, so the drop program is essentially it's a 3-year program currently where officers there's actually a fire program where they can enter into that, begin to collect their retirement, but they can only stay in the drop program for up to 3 years. So they enter the drop, they begin to collect their retirement, they commit to retiring at the end of that 3-year period. That's the way it currently works. So as officers get towards the end, or maybe when they get to the point where they decide that they want to go to another department, they'll start collecting their pension early. They'll stay on board and collect their salary on top of that. They can do that for a maximum of 3 years. And then they're sort of into the mandatory, they're required to retire at the end of that 3-year period. And so that, we've talked about potentially making that drop period a little bit longer, which would incentivize officers to stay on for an extra couple of years, particularly the most senior officers who have the most experience and ability to train other officers, things like that. So that's a mitigation method that we've talked about. We can't just do that unilaterally. That's got to be negotiated with the union, but that's something the county executive has expressed some interest in exploring.
Good. Thank you, Kevin.
He froze.
I think the image froze, yes. Kate Ryan, WTOP. Good afternoon.
Thank you so much. I appreciate it. I'll be very quick on the health officer, going back to this. Precisely when does the health officer go before the county council? And is that a public setting, or do they get to do a private interviews with this person? And at any time, does that go public, in other words, kind of a meet and greet with the county council and presented to the county council? And what kind of response did you get from this candidate when I'm assuming that you talked about, we had 2 others who were close to accepting, but then decided, with all the pressures and the negativity that's often thrown at health officers, what made them say, no, I'm okay. This is what I want. I'm not put off by that.
I can chime in a little bit about process. So typically what happens in a high profile nomination like this is that the council members will be afforded the opportunity to meet individually with the candidate, get to know them, learn some things about them, just have a conversation. But there will be a public, for sure, hearing where they'll ask interview questions to the candidate, as happens with other high profile department directors and other high profile question A nominees. Now, my understanding, and I haven't talked specifically to the candidate, but what I've been told from Dr. Kroll, who has been interfacing with the individual, is that they find the National Capital Region to be a very attractive opportunity because of the interface that we have with the National Institutes of Health, the National Cancer Institute, the FDA. There are a lot of healthcare infrastructure in our region, which presents some really interesting policy opportunities and collaboration opportunities that you could interface and build some unique programs. And so they viewed Montgomery County, as frankly we do, as a great opportunity for a health officer. And I think as Dr. Fauci says, we move beyond the pandemic phase of COVID-19 and think more about the endemic phase and what that means and how that translates. I think there are some opportunities to branch out from COVID-19, that have increased over time. And so I believe this candidate has expressed some interest in those opportunities to think about the things. Obviously, COVID-19 is going to be in the back of our mind, or really in front of our mind, I guess, at very different stages over the next several months. But there are opportunities in Montgomery County and our region in healthcare and public health that do not exist in many other places in the country. And so there are some attractive features. It's not all concerns to be the health officer in a place like Montgomery County.
Got it. And Mr. Elrich, and also, again, is the county council approval critical to the appointment? They can't sink it if they don't like it, or can they?
We'd be hard put to appoint somebody they didn't approve of. I mean, this goes to them for approval. So
Okay.
We're assuming, that they'll get a positive vote. We've found well-qualified people, and I think this person will make people, I think, happy, and actually was pretty conversant in the kind of things I talked earlier about where we want to go beyond COVID, because I think everybody realizes as important as COVID was, and as it kind of rose to the top of things we talked about initially, I think there's a recognition that, actually there's a lot more to this, and he's pretty well versed in, I think, looking at things in a broad perspective.
Got it. And I know we're tight on time, but I do have one last question that circles back to what Chief Jones said yesterday in the school setting about marijuana offenses and coming to this arrangement with schools. You handle the discipline. We will take the substance out of the buildings. Yep. Did they have to go to the state's attorneys to work out I don't know legally what that process is like? Because while, you may have legalization in some arenas and some states, et cetera, the feds still look at this as a controlled dangerous subject or substance. Was there any legal arrangement that had to be made?
I don't know of any legal arrangement they made. I mean, they can take the drugs, and which is what we want, is to take the drugs out of the school. We're not, and the state's attorney historically has not been interested in prosecuting, for minor drug offenses. I mean, I think we all realize all we do is ruin people's lives. There's zero benefit to, focus on prosecuting somebody for marijuana distribution, because it's just going to wind up that I now guarantee this person will have a very hard time getting a job. And then what do I exactly expect to happen if that's how that unfolds? And I think the whole country is beginning to move away from this. And if you think about it, a year from now, the state could pass a law legalizing it, which they probably will. And in the meantime, we just add to the number of people's lives we ruin before we get to that point. It seems like we're beating a dead horse. And I think we can look around and see just how totally unsuccessful, a few decades of the drug wars have actually been. Certainly didn't fix anything.
Got it. Thank you very much. I appreciate it.
Thank you, Kate. Kevin, I see you back on. Did you have a follow-up question? Because I know you kind of froze there for a minute.
Yeah, the computer totally kicked me off of Zoom. If I could have permission to record and just had a quick follow-up question. Thanks. So I guess as one looks at entering law enforcement, I don't believe that there's a collegiate requirement. So is there concern looking ahead with still the possibility of officers retiring and being able to do so at 45 years old, say if they join the force around 20, that maybe the 25-year pension eligibility is too low? To me, just hearing that 60% of the force is eligible for retirement and talking to many on the force and knowing that many are not happy with the current state of affairs, it seems precarious. So just wanted to get your reaction to, beyond pay raises, is that enough to keep them here?
I think, what I recall historically is that other public safety employees had moved to these shorter retirement ages, primarily because of the stress that folks work under, and a recognition that the stress takes a toll on people. And the longer you have to work to get to retirement, you're going to increase the stress that people experience, and they may not feel that it's worth it to try to get to 35 years if it means that the stress is going to build up. So the initial steps to do this were meant to make the county competitive in the first place. And so I think that, we're continuing. I'd like to be competitive there. What I hope comes out of all this is that through the kind of reforms that we're going to wind up making, which we hope will lead to a better trained police force and to creating expectations for everybody about what we're going to see, we should see from the police, that we'll be able to get back to a place where the kind of tensions and problems that, that all of us have faced. I'll say Montgomery County less than a lot of other places, but we still have issues here. That as we deal with that, policing can kind of return to a position where they don't endure some of the abuse they've had to endure. It is absolutely true that, and it's not the only case of this, where everybody gets blamed for what one person does. We don't celebrate the good things that happen, and anything that's bad becomes generalized across everyone. And hopefully we move beyond that and develop the ability to see, those who do well and do right, and deal with people who don't do well and don't do right.
And on the pay raises, it's the last matter. Do you intend to support what the council discussed yesterday on pay raises for police and the other departments as well?
Those are our negotiated agreements. So yeah, I'm going to support them.
Thank you very much.
Thank you. Thank you, Kevin. I do not see any more questions coming from reporters on that chat. So I believe we are done for today. Thank you, Director Durbin, for joining us today, as well as you, Kelly. And thank you, gentlemen. Have a great afternoon, everyone. Stay safe. We'll see you again next time.
Thank you all.
I take care.